Removal of the implant should only be performed under aseptic conditions by a healthcare provider who is familiar with the removal technique. If you are unfamiliar with the removal technique, contact the product manufacturer found in the prescribing information. Before initiating the removal procedure, assess the location of the implant. Verify the exact location of the implant in the arm by palpation. If the implant is not palpable, consult the user card or medical record to verify which arm contains the implant. Have the patient lie on her back on the table. The arm should be positioned with the elbow flexed and the hand underneath the head or as close as possible. Locate the implant by palpation. Push down the end of the implant closest to the shoulder to stabilize it. A bulge should appear, indicating the tip of the implant that is closest to the elbow. If the tip does not pop up, removal of the implant may be more challenging and should be performed by providers experienced with removing deeper implants. Contact the product manufacturer found in the prescribing information for further information. Mark the distal end of the implant, the end closest to the elbow. A surgical marker can be used. Clean the site where the incision will be made and apply an antiseptic. Anesthetize the site, for example, with 0.5 to 1 milliliter 1% lidocaine where the incision will be made. Be sure to inject the local anesthetic under the implant to keep the implant close to the skin surface. Injection of local anesthetic over the implant may make removal more difficult. Push down the end of the implant closest to the shoulder to stabilize it throughout the procedure. Starting over the tip of the implant closest to the elbow, make a longitudinal, parallel to the implant, incision of 2 millimeters towards the elbow. Take care not to cut the tip of the implant. The tip of the implant should pop out of the incision. The implant can now be removed. If it does not pop out, gently push the implant towards the incision until the tip is visible. If needed, gently remove adherent tissue from the tip of the implant using blunt dissection. Grasp the implant with forceps and, if possible, remove the implant. If the implant tip is not exposed following blunt dissection, make an incision into the tissue sheath and then remove the implant with the forceps. If the tip of the implant does not become visible in the incision, insert a forceps, preferably curved mosquito forceps with the tips pointed up, superficially into the incision. Gently grasp the implant. Flip the forceps over into your other hand. With the second pair of forceps, carefully dissect the tissue around the implant and grasp the implant. The implant can then be removed. If the implant cannot be grasped, stop the procedure and refer the woman to a healthcare provider experienced with complex removals, or contact the product manufacturer found in the prescribing information. Be sure to remove the entire implant. Confirm that the entire 4-centimeter implant has been removed by measuring its length. If a partial implant, less than 4 centimeters, is removed, the remaining piece should be removed. After removing the implant, close the incision with sterile adhesive wound closure. Apply a pressure bandage with sterile gauze to minimize bruising. The patient may remove the pressure bandage in 24 hours. The sterile adhesive wound closure may be removed in 3 to 5 days. Immediate replacement can be done after removal of the previous implant and is similar to the insertion procedure described earlier in the video. The new implant may be inserted in the same arm and through the same incision from which the previous implant was removed, as long as the site is in the correct location as described in the insertion instructions. If the same incision is being used to insert a new implant, anesthetize the insertion site. For example, 2 milliliters lidocaine, 1%, applying it just under the skin along the insertion canal. Follow the subsequent steps in the insertion instructions.